The surge continues. Coronavirus cases climb to more than 217,000 in our state. But there is some good news tonight. Hospitalizations and the positivity rate are down slightly. Hello, everyone. I'm Vic Carter.
And I'm Nicole Baker. Right now, local health officials, they are working on how Marylanders will get this vaccine. But until then, more hospitals are inching closer to capacity, and doctors think the worst may be yet to come.
WJZ investigator Mike Helgren is live at Johns Hopkins Hospital with the state's continued fight against this virus. Mike.
Vic, Nicole, at the beginning, we know that there won't be enough vaccine for everyone, not even for all frontline healthcare workers. But doctors stress the need for everyone to get vaccinated once it's available, and the governor will address this when he speaks to Marylanders tomorrow afternoon.
We are seeing record numbers of cases, hospitalizations, and deaths.
Maryland health experts talked about building the community's confidence in COVID vaccines.
What are the questions that they have? What are the concerns that are coming from the community?
We certainly see the value in setting up pods, which will be, locations of dispensing the vaccine.
Stuart Bell, a MedStar vice president, says he's worried about hospitals filling up.
I would call it almost like a tsunami, because it's not a big wave, it's sort of this slow, steady crescendo increase. And that's been layered really on top of taking care of our usual chronically ill patients.
Among the recent COVID-related deaths in Maryland, Rob Cadret, a 22-year veteran of the Charles County Sheriff's Office, and Antoine Ball, a 43-year-old teacher from Baltimore.
The community spread has become really considerable over these last 3 to 4 weeks.
Dr. Bell acknowledged there are different strains of COVID-19. The Ravens said 4 unique strains were found in their facility during the recent outbreak, and one was highly contagious.
There are different strains. However, we've not seen major differences in the acuity that each one causes.
During the early days of the pandemic, Maryland struggled to buy ventilators and PPE. Back then, Governor Hogan blasted Blue Flame Medical, a company run by Republican operatives that did not deliver more than $12 million worth of equipment on time. The co-founder of the company defended his actions in a new interview with 60 Minutes.
My company and I have behaved 100% legally and ethically.
Now, that company recently settled with the state of Maryland, with neither side admitting any wrongdoing. Reporting live at Johns Hopkins Hospital, Mike Helgren, WJZ.
All right, Mike, thank you. Tomorrow, Governor Hogan will be giving an update on the state's coronavirus response and recovery. And it's set for 3 o'clock. You can watch it live right here on WJZ.
Well, tonight, more than 1.2 million people have signed up for the MD COVID alert system, but experts say there's still a ways to go. The system launched last month and notifies subscribers that they've possibly been exposed to the virus. It uses Bluetooth technology, so it's secure and anonymous. The director of the Department of Health's contact tracing says the goal now is to get as many people to sign up as possible. If you haven't signed up, Apple users can opt in under Settings. Android users can download the MD COVID Alert app.
Well, one Baltimore company is keeping things cool. We're talking extremely cool. They are making the dry ice necessary to distribute and store Pfizer's COVID vaccine. Their vaccine candidate is likely to get FDA approval soon. But the problem is it needs to be kept at -94 degrees. That is colder than winter in Antarctica. So Pfizer called third-generation family business Capital Carbonic looking for small pellets of dry ice. They're made right here in Baltimore, and they keep the Pfizer vaccine at the right, very chilly temperature.